Good day, everyone, and welcome to another screencast here in microbiology. I am your professor for today, Dr. Supachai A. Basit, and for this day and for today, we will be discussing the host-parasite interactions, or basically, we'll be answering the questions how humans interact with microorganisms. So, for the introduction, we know for a fact that the host pathogen interaction is very important. And this particular interaction is based on numerous factors, including, of course, most importantly, the host immune system. And, of course, aside from the host immune system, the microbial factors inherent to invading microorganisms would also play a significant role. So these factors such as virulence factors of the microorganisms would really matter, whether the microorganisms have capsules, endospores, and other virulence factors. So gone are the days when people in the medieval period or during the ancient times would think that when the stars align, disease occurs, or when the stars do not align, disease does not occur. Okay, so let us now discuss what are the origins of the microbiota. The origin of microbial biota. Usually, formerly, they call it microbial flora. But they, of course, were able to decipher that microorganisms are not plants. So instead of calling it microbial flora, it is more applicable to call it microbiota or microbial biota. So, for the background and terminology, at birth, of course, we are sterile until birth because inside the amniotic sac is such an sterile environment. Okay, so the exposure to environment, okay, after birth, okay, actually leads to colonization. So when we say colonization, colonization refers to the growth of microbiota in or on a body site even without causing damage or notable symptoms. So that simply means colonization. Okay? So colonization may actually be different from infection because when you say infection, infection leads to a disease process. Okay. Now, there are several symbiotic relationships that we can actually discuss among microorganisms. Okay, so how do we interact with microorganisms? Okay, so actually we discussed this in parasitology already. So when you say symbiosis, these are two organisms living together. So as human beings, and as microorganisms, ecosystem inside the body. So we interact with them, so we have symbiotic relationship with them. Now, this particular symbiotic relationship may be classified as commensalism. So when you say commensalisms, so these microorganisms may act as a commensal. So it means that the microorganisms will benefit from us as hosts, but we are not harmed in the process. Okay. Unlike mutualism, microorganisms and host benefit. Okay, so of course this is the most among the three relationships that we'll be discussing here. Mutualism is, I think, is the most perfect. And then of course we do not want to have a parasitic relationship. So when you say parasitic relationship, microorganisms benefit while the host is harmed in the process. So there are, of course, characteristics of indigenous microbial flora. So when you say indigenous normal flora or normal microbiota for that matter, these are microorganisms commonly found in healthy persons. Okay? Healthy persons. So they do not cause any disease at all. Okay, so we may also consider them as resident flora, which means that these microorganisms have colonized an area of our body for several months or years already. Okay? So, which means that not all microorganisms are actually bad. Not all of them are, of course, pathogenic. So, a significant number of microorganisms are indeed beneficial to humans, but we are actually concentrating on pathogenic microorganisms in this particular course. Okay, so we also have what you call transient. So when you say transient, it means that these microorganisms are actually temporarily colonizing a host. So when you say transient, so it is these microorganisms are actually not permanent. Okay. Now, what is a carrier state? So a carrier state means that it is a condition of host capable of transmitting the infection, but the host itself may not necessarily exhibit signs and symptoms of a disease. So let's say, for example, asymptomatic COVID-19 patient may be carrier, so they do not show any signs and symptoms, but they are potentially infectious. So there are two types of carrier state. So a carrier state could be either acute carrier, so short-term carrier, or chronic carrier. So a chronic carrier is a long-term carrier. So an example of acute carrier is for example, COVID-19, asymptomatic carriers. Chronic long-term carriers could be people with a chronic disease such as hepatitis C. They do not show any signs and symptoms, but they are carrying the virus and they are potentially infectious. Even HIV infected individuals may also be considered as carrier because they appear normal. It doesn't seem like that they have a disease, but they are infectious. Okay. So, what are the composition of usual microbial biota? Okay. The composition of the microbial biota is actually influenced by the specific nutritional and environmental factors. You are what you eat. Okay? So, for example, our gut intestinal microbial flora might be influenced on our diet. Okay? And of course, the microbial biota in the stomach, or rather in the intestine, may actually be different from the ones found in our skin or from the ones found in our respiratory linings. Okay, so it depends on the environment. Okay, so the affinity of microorganisms for a specific site may depend on several factors. For example, the ability of the organisms to resist the antibacterial effects of bile, lysozymes, and fatty acid. One of the best examples is Staphylococcus, which is commonly found in our skin. So, of course, whenever we sweat, our skin may have high salt concentration. But since Staphylococcus may able to tolerate high salt concentration, then they are able to grow in our skin. Now, Helicobacter pylori. Helicobacter pylori is such a unique bacteria because these bacteria are able to grow even in a very corrosive acid pH of our stomach, of our gastric juice. Why? Why do you think they're able to resist the acidity of our gastric juice? Primarily because they're able to secrete the enzyme urase, which may somehow neutralize the acidity of the gastric juice. So it really depends, okay, on the inherent characteristics of these microorganisms. So what are the environmental factors? So, of course, environmental factors depend on what particular area of our body that these microorganisms have already established the so-called ecological niche. So, for example, whether they are living in moist or dry area. So, most microorganisms live in moist areas such as skin folds in our armpit. Okay? Or, for example, for female, you have the Lactobacillus acidophilus or the Dodderlane bacilli. Okay? For low pH, because in female genital tract, Lactobacillus acidophilus is actually the resident normal microbiota. And are they important there? Yes, because these microorganisms have already established ecological niche. They are highly territorial, which means that if a certain group of microorganisms will try to invade that particular area of our body, they may find it difficult because these normal microbiota have already established ecological niche. So not only in the female genital tract, the gastrointestinal tract of breastfed infant, okay, may have beneficial microorganisms to protect them against pathogenic microorganisms that may lead to various gastrointestinal tract disturbances such as diarrhea. So the gaseous atmosphere, okay, particularly the presence of low oxidational reduction potential, may also influence a particular normal microbiota in that particular area of our body. So for example, at the gingival pocket of our teeth, okay, so only anaerobic bacteria would be able to grow there. So there are several composition of microbial biota at different body sites. So we may be able to classify them as good or bacterial microbiota. So, and in this particular illustration, it says here, Bifidobacteria, Escherichia coli, and Lactobacilli are considered to be as good bacterial microbiota or good microbiota at the gastrointestinal tract. But let me emphasize this to you that not all strains of E. coli are actually beneficial because some strains may be considered as pathogenic. So bad bacteria, okay, which can usually cause that most of the time can cause diseases. They are highly pathogenic, would include, for example, in the gastrointestinal tract are Campylobacter, Enterococcus faecalis, and Clostridium difficile. Okay, so the human host is colonized by a large number of different species of microorganisms. So you can just imagine there are approximately 500 different species, okay, have been characterized in oral cavity alone. Can you just imagine it, okay? Microbial infections is actually common among immunocompromised patients. So what are examples of immunocompromised patients? Patients at the terminal stage of HIV infection, meaning they are already having AIDS, acquired immunodeficiency syndrome. Patients who have genetic immunodeficiency disorders, patients who have been taking immunosuppressive drugs because they just received a newly transplanted kidneys, patients who have been undergoing chemotherapy or who had undergone such a traumatic accident or with underlying conditions such as diabetes, they may be all considered as immunocompromised patients. Okay, so the clinical microbiologists such as medical technologists must be able to recognize and identify the types of microorganisms found in various body sites. Meaning to say, if we are able to isolate E. coli in the stool, it doesn't necessarily mean that that E. coli is said to be pathogenic. So we don't usually perform antibiotic susceptibility testing from E. coli isolates in the stool unless you have it serotype and that particular strain of E. coli is said to be indeed pathogenic, such as the E. coli 015787. So let's talk about the normal microbiota of the skin. Okay, skin. So these are generally superficial organisms found on the skin surface and even in between these hair follicles. So the apocrine sweat gland, okay, will actually secrete substances metabolized by bacteria. Because of the presence of bacteria in the skin, when bacteria comes into contact with our sweat, it will release odorous amines. In other words, yung amoy putok, okay, anghit in Tagalog. So that's actually an odorous amine. So pag meron kayong nakasalubong na wag na natin pag-usapan. Okay. So, amoy odorous amine. So, but anyway, let's go back to our lesson. Normal microbiota or normal flora would colonize the skin surface. As much as possible, I will be avoiding saying normal flora, but actually I got this PowerPoint from Mayhon. So, it prevents pathogens from colonizing. This is very important. That is the reason why hand washing is preferred over alcohol, because if you keep on placing alcohol, you keep on rubbing alcohol in your skin, you're actually destroying normal microbiota. But with the current pandemic state that we are facing right now, one cannot help but apply rubbing alcohol every now and then in our hands. And advantage, yes, that's the most convenient way of destroying the virus that may cause COVID-19. Disadvantage, you are actually destroying normal microbiota, which is of course beneficial also to our skin. That's why you have to balance things out. So hand washing is preferred over rubbing 70% alcohol, because 70% alcohol will actually dry your skin. But in cases wherein you're not accessible to a hand washing station, then alcohol may actually. So these are the different microorganisms found in our skin. So we have um, common residents include Candida, Micrococcus, Staphylococcus, Propionibacterium, which can cause acne, Propionibacterium acnes, and then diphtheroids. Okay, the less common or the transients are the Streptococcus species, Acinetobacter species. So remember, if it's SPP, it's plural, okay? Gram-negative rods and even the Moraxella. Okay, now let's talk about the normal microbiota of the oral cavity or the mouth. So this particular group of microorganisms may cause bacterial plaque, okay, and this may develop on the surface of our teeth. So majority of these organisms would require low oxidation reduction potential, which means that these microorganisms are anaerobic microorganisms. So the buccal mucosa and the tooth surface may have microorganisms, and these microorganisms eventually, because of the anaerobic respiration, one of the products or metabolites of that anaerobic respiration is acid. And acid may destroy the enamel of our tooth, and that will eventually result into dental caries or tooth decay. Okay, so the most common are Staphylococcus epidermidis, Streptococcus mitis, Streptococcus sanguinis, Streptococcus salivarius, Streptococcus mutans, by the way, is the leading cause of dental caries. And then Peptostreptococcus, Veillonella species, Actinomyces escherichia, Bacteroides species, another example of anaerobic bacteria, Prevotella and Porphyromonas, Bacteroides oralis, Treponema denticola, Treponema refrigerans. Okay, so these are all common residents of the oral cavity. So less common or transients are Staphylococcus aureus and several species of Enterococcus. Okay, so let's now proceed to the normal microbiota of the respiratory tract. So what you can actually see, okay, on the background is an example of the electron micrograph view of the nasal, okay, lining, wherein you'll be able to see cilia, okay, respiratory lining, okay, wherein you'll be able to see cilia, okay. So upper respiratory tract would include the mouth, the nasopharynx, the oropharynx, and the larynx, and then the lower respiratory tract would include the trachea, bronchi, pulmonary parenchyma. So they are being protected by ciliary epithelial cells and mucus. And this area of the lower respiratory tract is supposed to be considered as sterile. Okay? Particularly in the trachea, that one is being lined by the pseudostratified ciliated columnar epithelium. Okay. So the normal biota of the respiratory tract, as what I told you, it's a duplication of the slide, is considered to be as sterile. Okay, however, there are some microorganisms, such as the one that you can see here, that is an example of Klebsiella pneumoniae, one of the pathogenic organisms that may invade the respiratory tract. So these are the microorganisms found in the nose and nasopharynx. So common residents include Staphylococcus aureus, Staphylococcus epidermidis, diphtheroids or the small Corynebacterium, Haemophilus parainfluenzae, Streptococcus species. So the less common or the transient microorganisms are Streptococcus pneumoniae, which could also be pathogenic. Okay, Moraxella cataralis, Haemophilus influenzae, Neisseria meningitidis, and Moraxella species. So there are also microorganisms found in the oropharynx. I will not be mentioning them one by one. So if you want, you can pause this video and have it screenshot so that you'll be able to record it. Or better yet, you read your book. So we are actually in chapter 2. Okay. So let's talk about the normal biota of the gastrointestinal tract. So our gastrointestinal tract consists of the esophagus, stomach, small intestine, and colon or the large intestine. Our gastrointestinal tract is equipped with numerous defenses. Yes, because found in our gastrointestinal tract are several lymphoid organs such as the Peyer's patches. So we actually call it the gut-associated lymphoid tissue. And aside from that, we also have several effective antimicrobial factors. Do you know that some microorganisms such as E. coli can produce bacteriocins, and bacteriocins can actually prevent pathogenic microorganisms from invading our gastrointestinal tract? Do you know that it is estimated, okay, that the number of possible GI microbial residents, okay, would be over 35,000. So in terms of population density, our gastrointestinal tract has the highest number of microorganisms. So the stomach, as what I've told you, is normally sterile due to it is very corrosive because of its very acidic pH. But there are some microorganisms that will be able to invade our stomach, particularly for some microorganisms with endospores, the parasitic yeast, for example, of Giardia lamblia and Entamoeba histolytica, and another pathogenic microorganisms that can cause gastric ulcer, and that is your Helicobacter pylori. So other pathogens enter in food particles. So food particle, we call it vehicle. So water and food particles are considered to be as vehicle. Because they are in the vehicle, they are able to escape stomach and eventually enter the intestine and colonize the small and large intestine. Now, there are some antibiotics. We do not want to have an overdose of antibiotics because overdosage of antibiotics can significantly alter the usual flora, and this may result to antibiotic-associated diarrhea, the one that is caused by Clostridium difficile. Okay, so these are the microorganisms found in the gastrointestinal tract. Okay, let's talk about the normal biota of the genital urinary tract. So what are the sterile sites? So this would include the kidneys, bladders, and fallopian tubes. So we do not want this particular organ to get infected because this will really entail that there is a presence of a significant infection. So non-sterile sites are the distal urethra, particularly in women, and vagina. So these are the non-sterile sites. So these are the different microorganisms of the genital urinary tract. Okay, so noteworthy to mention is Lactobacillus acidophilus. So this is very significant for female because this prevents harmful pathogens that may cause UTI and other infection to actually colonize the genital urinary tract. So that's the reason why maintaining the acidity of the female genital urinary tract is actually of utmost importance. Okay, so what are the roles of microbial biota in the pathogenesis of infectious diseases? So there are actually some instances when good biota turn bad, and this will result to several. This may be caused by several factors. Number one is opportunistic infection. So this cause disease when the habitat is changed, or it may occur as a result of a weakened immune system. So when you say habitat is changed, this may actually be due to infection, or it may actually be due to trauma or accident. It may occur due to weakened immune system, such as for people with AIDS or who have been undergoing chemotherapeutic agents or have been drinking immunosuppressive drugs. Okay, trauma is the introduction of the flora to the supposed sterile sites and immunosuppression. This is what I told you a while ago: immunosuppressive drugs, chemotherapy, radiation, and even immune defense. Okay, so in patients with serious infections such as diabetes or severe hepatic disease such as cirrhosis, okay, so this normal microbiota will actually become opportunistic. So, what are the role of microbial biota in host defense against infectious diseases? Actually, I've told you this a while ago. They are important because it seems that they have already established an ecological niche, okay, and it will be difficult for invading microorganisms to colonize our body if we have normal microbial biota. Okay, so these are the benefits. Okay, normal microbial flora will prime the immune system. Okay, this was actually demonstrated among axenic animals and experimental animals wherein they remain to be germ-free. Okay, the sterile environments will also impair immune development. Remember, in immunology, if these T cells and B cells are not able to encounter any antigen at all, they will become naive and eventually these cells will undergo apoptosis. Okay. The microenvironment refers to the presence of microbial flora, okay, which block the colonization of extraneous pathogens. I've been telling this to you. This normal microbiota have already established an ecological niche on a particular area of the body. That is the reason why invading microorganisms will find it difficult to colonize that area of the body. However, too much administration or overdosage of antibiotics can alter the indigenous biota. So that's the reason why there are some, for example, diarrhea that is associated with an overdosage of antibiotic. So that pathogen may actually be Clostridium difficile. So there are microbial factors that may contribute to pathogenesis and virulence. Okay. So when we say pathogenicity is the ability of an organism to produce the disease. Okay, so highly pathogenic means that they can cause a disease state in humans. So we have what you call opportunistic pathogens. So when you say opportunistic pathogens, these are microorganisms that do not usually cause infection. However, it may cause infection under special circumstances, such as the one that we've discussed. Instances when good bacteria or good biota turn bad because of these factors. Okay, so they become opportunistic. Okay, so these are the most common representative opportunistic microorganisms. So what conditions will compromise the host defense? The presence of foreign bodies, such as if a person is under a catheter or prosthetic heart valve, in cases of alcoholism, in cases of burn, in cases of hematoproliferative disorders, in cases of cystic fibrosis, in cases of immunosuppressions. All of this may allow these corresponding organisms to become opportunistic. So pause and screenshot this one. Very important. Okay. So the pathogenesis, of course, these organisms may be considered as true pathogens or iatrogenic infection. So true pathogens meaning these organisms are indeed pathogenic by nature. So organisms that can cause disease even in healthy immunocompetent hosts. No matter how healthy you are, if you are infected with these microorganisms, this will really indeed cause an infection, such as Yersinia pestis and Bacillus anthracis. And when you say iatrogenic infection, this result as an outcome of medical treatment or procedure, such as, for example, wrong technique in venipuncture, you fail to place antiseptics, or let's say a trauma during lumbar tap to collect cerebrospinal fluid. So this may result into iatrogenic infection. Or, for example, uh, incorrect sterilization equipment for surgery. So this may result also to iatrogenic infection. So there you have it. That the end. This particular slide is the end of the introduction to the host-parasite relationship. So be sure that you will listen to the next module, which is about the transmission of the diseases. So once again, this has been Dr. Supache Basit saying, wherever you are, stay safe everyone, and God bless you all.